Hi, my name is Kyle Morrison. I'm a student with Valdosta State University, the FMP program, and this is Carly Morrison. She'll be my patient, and do you give consent to be on video?
Yes, I give consent.
Okay, perfect. So we're going to go over a basic HEENT assessment. The scenario is Miss Morrison here is here for a stuffy nose and a little bit of a headache. Okay, so let's begin. Hi, Miss Morrison. I'm Kyle. I'm the nurse practitioner on staff today. How are you?
Good.
Good. What brings you in today?
Headache and stuffy nose.
Headache and stuffy nose. Okay. Well, how long has the headache been going on?
Couple days.
Couple days. Okay. Where does it hurt as far as the headache? Is it behind the eye? Maybe in the temporal region?
I guess about right here.
Okay, a little bit higher. Let's see, and what about the stuffy nose? How long has that been going on?
Probably a couple days too.
Couple days, okay. Any pain or drainage associated with it?
No, not really.
No? Okay. Does it seem to last all day long, or is it just certain periods of the day?
Pretty much all day long.
All day long, okay. Is there anything that makes it the headache worse or the stuffy nose worse?
No, nothing makes it worse.
No? Anything make it better?
Sleeping makes the headache go away.
Sleeping makes the headache go away, okay. Do you do any kind of medicine or treatment?
No, I don't like medicine.
Okay, what about any kind of treatment like herbal teas, complementary medicines?
No.
No? Okay. Do you have a history of vision problems?
No, I should wear glasses, but I don't.
You should. When was the last time you saw an optometrist?
It's been about 2 years.
2 years, okay. Do you have any allergies?
No.
No allergies? Have you ever been tested for allergies?
No.
No? Okay. Let's see, what else? Got me.
Restart.
No. So, no vision problems, other than you probably should see an optometrist. Do you notice yourself squinting?
Sometimes. Depends on where I'm sitting.
Do you do a lot of reading or computer work?
Computer work. Reading not so much. I guess reading on the computer.
Okay. Any sinus problems? Do you take like anti-allergy medications?
No.
Any pressure?
No.
Okay. Do you have a history of hypertension?
Only one pregnant.
Only one pregnant. Okay. What about a family history? How old is your dad?
How old is he?
How old is he?
57.
Okay. What kind of medical diagnoses does he have?
He's got AFib and hypertension.
AFib and hypertension. Okay. What about your mother?
I don't know.
That's okay. Any medical history associated with her?
I think she's got COPD, but
COPD. Okay. What about your mother or your mother's your mother's parents?
they're obese.
Obesity. Okay. Any other issues?
Not that I know of.
Okay. What about your father's parents?
They were pretty healthy till they died.
Okay. What did they die of?
My grandmother died, I guess, of a stroke.
Mm-hmm.
And then my grandfather died of cancer.
Okay. What type of cancer?
Colon cancer, I think.
Okay. Okay. Let's see. What about social history? What do you do for a living?
I stay at home.
Okay. What about education?
I'm working on my master's degree.
Okay. I want to speak up a little bit for the computer. Working on your master's degree. Okay. Any stress lately?
Nothing more than usual.
Okay. Feel like you can handle financial responsibilities decently?
Yes.
Okay. Let's see. Let's see. So you have your you have headaches, no kind of discharge, watery eyes, any kind of hearing differences, ringing of the ears, no, no stuffiness, no jaw pain.
No.
No. Okay. Any photosensitivity or difficulty adjusting to light?
No.
No. Okay. Let's see. Any sore throat? Any kind of difficulty swallowing?
No.
No. Okay. Let's see. Any changes in hearing?
No.
Any changes in vision?
Not that I know of.
Okay. Any difference in smells?
No.
No. Okay. Have you noticed any kind of swelling anywhere,
No.
particularly the throat?
No.
Okay. All right. Let's see. Well, if you don't mind, we'll go ahead and begin an assessment and see if we can't figure out maybe what the underlying issue is. Okay. So I'm going to focus on your head. So I'm going to feel around your head and just see if there's any kind of lesions, scars, anything of that nature. Okay. So looking for any kind of scars, scabs. Have you had any head trauma recently?
No.
Okay. Good. Any history of seizures?
No. No.
No. Okay. Let's see. Good. Okay. Let's see. So head is normocephalic. Do me a favor and close your eyes. Okay. And tell me what you feel.
You're rubbing your finger across my forehead.
Okay. So a light touch.
Yes.
Okay. How about now?
You're touching on my cheek.
Okay. Would you say that's a sharp sensation?
I mean, it's not hurtful, but I guess you could call it sharp.
Okay. And now, soft or sharp? Okay. And now?
Sharp.
Okay. Very good. So that's cranial nerve 5 we're testing. It's intact. If you would also clench your teeth. Good. Okay. That's also cranial nerve 5. If you would raise your eyebrows. Good. That's cranial nerve 7. It's intact. Now we're going to check for cranial nerve 6. Okay. And we do that by following my finger for me. Okay. With only your eyes. I know, it's a difficult test. So just your eyes. Good. 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 Very good. No nystagmus noted. We have accommodation there. Let's see. If you would, stick out your tongue for me. Okay. Very good. So that's cranial nerve 9. Testing to make sure that the tongue is midline, which it is. Now I'm going to feel your lymph nodes, okay, around your neck, see if there's any kind of swelling involved. That's usually indicative of maybe some sort of infection, okay? So we have the preauricular lymph nodes here, no swelling noted. We have the postauricular here, occipital, got submental, submandibular, supraclavicular, no swelling noted. Let's see. Got superficial cervical chain, deep cervical chain, and lastly, the posterior cervical chain. No swelling noted there. Doesn't seem like any signs of infection. Now, if you could, I'm going to test cranial nerve 8. Let me know what you hear.
rubbing noise.
Okay, good. Okay, now close your eyes. Tell me what you hear over here.
Soft rubbing noise.
Okay, good. Good. Let's see. I have here a little bit of a smell. Okay, I want you to smell it and let me know what you smell.
Peppermint.
Peppermint. Good. Okay, let's see. Now we're going to test cranial nerve 8. That was cranial nerve 1. Cranial nerve A is going to test hearing. Okay, much like that little whisper test, but this time we get to use a little tuning fork. Okay, so the first test is the Weber test, where I'm going to strike the tuning fork, place it on top of your head, and I need you to tell me if it lateralizes to one side or the other. Okay? Where is that?
I hear in both ears.
Very good. Okay. Now the next is called the Rene test. The Rene test, I'm going to strike the tuning fork, place it behind your ear, and I'm going to count how many seconds you hear it. Once you stop hearing it, I need you to let me know, and I'm going to switch it to be right by your ear. Okay? And once we do that, you're going to tell me again when you stop hearing it. Okay? Let's see. So let's do your right ear first.
I don't hear anymore.
Okay.
I don't hear anymore.
Okay.
I don't hear anymore. I don't hear anymore.
Okay, good. So the air conduction was twice as long as bone conduction within your left ear. That's normal. Okay? However, your right ear was a little bit off, but I think that was more user error, quite possibly the receptor of the test. You failed. Okay, so let's try it one more time. Okay, if you would tuck your hair a little bit more. Is that okay? Okay. Because hair can even disrupt the test. So let's try one more time, see if we can get a better result.
I don't hear anymore. I don't hear anymore.
Okay. So that once again, you had a little bit more bone conduction reception rather than air conduction. So you do seem to have a little bit of maybe sensory neuro hearing loss within the right ear. Okay, but that's something we'll see. We'll make a referral, and maybe we can delve a little bit more into that. Okay? Let's see. So now we're going to have a little fun with light. First, I'm going to look at your eyes, okay? Sure you don't want to get that? So what I need you to do is look at my nose, okay? And we're going to test cranial nerves 3 and 4, pupillary response, okay? So just keep looking at my nose, okay? Nice, round, reactive to light, okay, with accommodation, or consensual pupillary response. Okay, same there. Okay, now I need you to stare straight ahead over my shoulder, and I'm going to bring the light over, around, and I'm going to look inside your eye, okay? But right now I can tell that you have healthy eyes. Your sclera is nice and white. Your iris is nice, round, blue, and nice and crisp. Now I'm going to look inside of your eye, okay? So just keep staring straight ahead, okay? A little bit of red reflex. Seeing some healthy arterioles and veins. Okay, don't mind me making my way. Okay. Looks like we have a nice crisp macular disc or optic disc. Okay. Take a break. Okay, now we're going to do the same with the other eye. Okay. I'm going to start over here. Okay, a little bit of red reflex. See some nice, healthy looking veins and arteries. Okay. Nice, crisp optic disc. Very good. Okay. Gather yourself. Feel okay? Okay. So now let's take a look at your nose and ears, okay? So do me a favor and look straight up. Okay, I'm going to put a little pressure on your tip of your nose and see what's inside. Let's see. So we have no nasal discharge. Your septum is nice and midline. No perforations. Mucous membranes are intact. See, a little tickle. Okay. Seeing an inferior, middle, turbinate, and superior turbinate. Okay, same over here. Taking a little look. Oh, good. Same. No swelling of the turbinates. That's good. Mucous membranes are intact. Doesn't look like we're dealing with any kind of sinusitis, any polyps, any issues of that nature. Okay. Now, if you would, let me see your mouth as well. Okay. Stick out your tongue. Good. See tonsils appear intact. Yeah. Do this. Frenulum is intact. Glands, none are swollen. Okay, dentition, all teeth are intact, no cavities. Let's see, stick out your tongue. Tongue midline, shift it side to side. Okay. See now, so that's cranial nerve 9 is intact. Now stick out your tongue and go ah. Cranial nerve 10 is intact. Uvula made an upward movement as well as the soft palate. Now let me take a look at your ears. Specifically, I'm going to look at your tympanic membrane. Okay. Little tickle, little pressure. I'm pulling the pinna up and back. There it is. Okay. Nice, pearly white, pearly gray. Cone of light is in the 5 o'clock position. Okay, very good. Little cerumen build up. Clean your ears often?
No.
No? You should. You should. Okay, let's check out the other ear. And behind the helix, nothing noted. Within the helix, nothing noted. When I push on the tragus there, any pain?
No.
Okay, what about here?
No.
Okay. Check behind the helix, nothing. I'm going to pull the pinna back. Take a look at this ear. I know, little pressure, little tickle. Pinna back. Once again, we gotta do some cleaning. Okay. Let's see. A little technical difficulty. Okay. Okay. So tympanic membrane, nice pearly gray. Cone of light is in the, what is it, right? Where did I see it? Saw it in the 5 o'clock position. Left ear was in the 7 o'clock position. Now I need to feel your thyroid gland, see if there's any kind of swelling involved, see if there's any kind of thyroid issues. Okay? So I'm going to come behind you. Okay. So do me a favor. I need you to turn to the right side. I need you to take a big swallow. Good. Okay? Turn towards the right. Okay. And do a big swallow. Good. Good. Okay, no swelling noted. I just want to check some pulses, okay? So first, no thrill. Got +2 graded pulse, nothing abnormal. Gonna feel your carotid. +2. +2 equal bilaterally. Let me take a listen to them. No thrill or bruit. No thrill or bruit. No thrill or bruit. No thrill or bruit. Okay. Let's see. Anything I miss? What I miss? What?
My eyes.
Oh yes, thank you. So, a little bit of a cheat sheet, but we need to test cranial nerve 2, okay, using a Rosenbaum chart, okay. This, you're going to take the letters here, or I'm sorry, the numbers, and start with the smallest line you can and read them out to me, okay?
The smallest one?
Yes, the smallest.
Both eyes or one eye?
Do one eye at a time. Okay. No, don't do that, because then your vision gets all blurry. Yeah, there you go. All right, read the smallest one for me.
937,826.
One more time.
937,826.
Go one line up.
374258.
Go one more up.
428365.
Okay, one down.
374258.
Okay, one down.
9378226.
One more down.
426739.
Wow. Okay. It's 20/20 out of 20/20 vision. Okay, in the left eye. So let's try the other eye.
Oh, jeez.
All right, try it out for me.
The smallest one.
The smallest one.
428365.
Okay, good. Try the next one down.
374256.
Okay, so you missed one. You missed one out of that line. Okay, so that comes out to a 20 out of a 30. I would recommend getting an optometrist referral. Okay, we can work on that. Especially for any kind of detailed reading, your eyes being of different acuities, that's definitely something to look into. Okay. So let me review kind of the data we have here. I'm going to come up with a plan.
Okay.
And I'll be back.
Okay.
Okay. Go ahead and